my name's Joel Chidester, or Dan Chidester, sorry, that's my first name. There's my ID. If you can't see that, I actually put it on one of the slides, so that might work a little better. So my initial idea for my capstone was to compile learning materials to help new nurses complete their competency certification. In the beginning stages, it became clear that the scope of that project was going to be too extensive and frankly unnecessary, so I decided to focus on competencies that were critical in nature but not frequently used, and found that to be helpful to our staff and nurses. Motivation for doing the project was based on the fact that it took me over a year to sign off on my emergency department and medical surgical nursing competencies, but 80% of those competencies were done in the first 3 months. It was the other 20% that were critical in nature and were tough for me to do because I just wasn't seeing them. My facility is the only level 4 trauma center in central and rural Utah. And to keep that designation, we have to be able to do those 20% of difficult competencies. A lot of those have time-sensitive core measures that we have to meet. And in order to be most beneficial, my mentor and I work together to consult with providers, experienced nurses, and new nurses to identify the competencies that were most troublesome, unfamiliar, and critical in nature, and that would be good to have improved resources and learning materials. This is just a little map showing our facility is, you can see it right in the middle there, right here. Otherwise you have to go to Payson or all the way to Cedar City to encounter another, Cedar City's clear down here, but to encounter another level 4 trauma center, so it's kind of a unique situation for us. Some of the things that were brought up by other nurses that were difficult were acute myocardial infarction, strokes, conscious sedations, cardioversion, blood product administration, sepsis, which will not be included because we already have good quality tools for that. TPN, electrolyte replacement protocols, central lines, and chest tubes. So the project concept involved resources such as flow sheets, charting helps, required supplies, commonly used medications, and procedural requirements in each of those areas. Flow sheets were enlarged and made available as a quick resource in the emergency room. Organizational benefits. The organization as a whole benefits from competent nurses. The hospital is unique in its ability to provide trauma care but still ends up transferring patients after stabilization. The care we provide is reflected by ultimate patient outcome at the end destination. Our ability to influence positive outcomes is a reflection on us, but also has an effect on the perception of the quality of the receiving facilities. What we do can help them make look good or look bad. They pay for our mistakes and benefit from our successes. In our own department, we are especially likely to encounter a wide variety of conditions just infrequently. In many situations, our department is staffed with only one nurse, one physician assistant, and an on-call respiratory, lab, and imaging service during the night, which is when I work is during the night, so that applies to me. Our ability to competently carry out a wide variety of skills is essential to our success. Having flow sheets and educational materials is beneficial in this setting, and like most new nurses, I've found myself in time-sensitive situations being unsure of myself or being nervous. Having that quick reference at hand is like having a second nurse on hand to double-check our work. Given my somewhat isolated location, choosing a mentor seemed like it would be tough. Rural nurses are expected at any given time to do just about everything that falls into the scope of a nursing practice. That said, having that many nurses that specialize in anything actually made choosing a mentor actually a pretty easy to do. I had lots to choose from, but I chose my mentor because I've worked with him for 3 years. We work good together, and he's a good teacher, and he's honest and competent. One of the other things he does is he likes to focus his teaching on value-based competencies, which these critical care competencies would fall into that. He's made it a kind of a thing of his to be excellent at those competencies and kind of just let the other ones come with experience, which is probably appropriate since most people know the basic competencies already. Goals: improve my own familiarity with higher level skills, help others to avoid bad patient outcomes by increasing their competency and response time in critical situations, provide a resource that allows rural new grads to progress through orientation process without delays and extensions, encourage mastery of advanced skills for all nurses, and participate in training. One of my initial ideas for valuation was just to base success off of new nurses getting through their orientation process within that 1 year time frame. That's not going to be applicable for this course. It would take a long time to do that, so rather we just created surveys. So there's we have at any given time roughly 6 nurse coaches. Right now we have 4 new graduate nurses and 2 new hires. Our survey was provided to each of them, asking them if they thought the resources were helpful, if they would use those resources to help pass off orientation, and if they would use them in their own practice. And they all said yes to each of those questions, so that is a measure of success in terms of that survey. Biggest problem that we encountered with this project, well, 2 of them. One was that we had this project that needed to fit a specific need, so we had to alter it to meet that. In order to do that, it took maybe a little bit more research to find good resources for those advanced skills, as opposed to just coming up with generic ones for every single competency. And I thought the result was good. I worked with my mentor on average 2 times per week. We had meetings to consult on ideas and modification of the project. In the end, we decided to focus on critical care processes, which I think he wanted to do all along. It's also worth mentioning that I consider all of my coworkers mentors, and throughout this project I did collaborate with a lot of them, including PAs and charge nurses and nurse coaches, so that it was valuable to be able to work with them. So the achievement of the goals, I think I successfully achieved all of my goals. Not in the way I initially thought I would, but I was able to measure success in all of them, and I was able to evaluate my own progress and familiarity with those critical care processes, and new and experienced nurses expressed the ability to use the resources to pass off competency and expressed value in resources in their own practice. And a binder with resources and flow sheets was created and is available, and that will be continued to be evaluated. So some of the benefits I saw, and I think this applies to both to me, my organization, and my department, was that my own core measures, meaning things like having an EKG within 5 minutes of a chest pain arising, those core measures for me improved. My timings were better. I also saw improved patient satisfaction scores for the patients I took care of. Some of them even left comments for me, and I think that reflects both on the organization, facility, and myself. Biggest benefit to me personally was the opportunity to train new nurses. As we was going through some of these discussions with nurses, I ended up taking some of their students to teach them some of the things that I had come up with in these resources. So improved leadership and teaching was a benefit I saw for myself as a professional. And I think that's something in the future that I would like to do as well, whether it's nurse educator or even in a college setting, would be to continue my teaching. Project Enlarge was a success. It cemented in my eyes the importance of identifying valuable ways to increase knowledge with the input of my mentor, nursing staff, and healthcare teams. While completing an educational binder with helpful education and flow sheets was a success and beneficial, it was also a great learning experience in learning how to adapt to situations and change. I found the leadership aspect appealing and will be more engaged in committees for improvement in my workplace.